In this lecture, we're going to be covering chapters 11 and 12 in our Medical Law and Ethics textbook. Chapter 11, Ethical and Bioethical Issues in Medicine. Early history, the Hippocratic Oath, 400 BC, principles for his medical students to follow, principles stated in the oath found in many professional codes of ethics today. Ethical standards and behavior, moral principles or practices, customs of the medical profession, and matters of medical policy. If accused of unethical behavior or conduct, one can be issued a warning or a censure, which is a type of criticism, formal criticism. The AMA Board of Examiners may recommend expulsion, which is forcing one out of their field, or suspension. If convicted of a crime, this may result in fine, imprisonment, or the revocation of one's license. Codes of ethics are adopted by professional organizations, summarize the basic principles and behavior expected by all in that discipline, and are meant to govern conduct of members of that given profession. American Medical Association, the AMA, Principles of Medical Ethics, discusses human dignity, honesty, responsibility to society, confidentiality, and the need for continued study. It discusses patient autonomy, responsibility to improve the community, the responsibility to one's patient, and to support access to medical care for all people. Judicial Council opinions of the AMA is comprised of 9 members, which interpret principles of medical ethics. Council's interpretation or clarification are published for AMA members. All members are expected to cooperate with the physician in upholding these principles. Nurses Code of Ethics, developed by the American Nurses Association, or ANA. Code discusses a nurse's obligation to protect privacy, respect dignity of a patient, maintain competence, and assume responsibility and accountability for judgments. Code of Ethics of the American Association of Medical Assistants provides guidance for many of the dilemmas regarding right and wrong that medical assistants face on an almost daily basis. It's concerned with doing the right thing at the right time. Bioethical issues are issues resulting from advances in medical technology, such as cloning, harvesting embryos, or in vitro fertilization. Scientists are able to decode our genetic composition, or our genome. Stem cell research has become an important topic as well. Organ and tissue donation. People may voluntarily donate their organs and tissue by issuing advance directives. Law prohibits the sale of organs. The National Organ Transplant Law of 1984 addresses that. United Network for Organ Sharing, or the UNOS system, consists of more than 106,000 people listed on that particular waiting list. United Network of Organ Sharing is the legal entity in the United States responsible for allocating organs for transplant. Gives half weight to consideration of one's medical need and the other half to considerations of justice. The ethics of transplant rationing. Criteria for rationing transplants are controversial. In a donation model, organs are taken, harvested, with the consent of the donor or the donor's surrogate representative. The Uniform Anatomical Gift Act permits competent adults to allow or forbid use of their organs after death. Social utility method of allocation entails the careful screening and matching of the donor and the survival probability evaluated for the recipient of the organ. Justice considerations gives everyone an equal chance. Ethical issues and personal choice. Some may have a personal, religious, or ethical reason for not wishing to be involved in a particular procedure. Preference should be stated before one is hired. Ethics of the employer must be in agreement with the ethics of the healthcare professional. The ethics of biomedical research. Human beings cannot be used for testing unless they consent to participate. So a consent must be obtained. Non-therapeutic research also requires that consent must be obtained. Justification for all medical research is that benefits must outweigh the risk. Researchers must abide by established standards for testing. The Department of Health and Human Services implements the government standards. Institutes that receive federal research funds must have institutional review boards, IRBs, to oversee the research. Consent, informed consent, is necessary when a patient is involved in therapeutic research. It must be made aware, or the patient should be made aware of all risk involved. Patient must be informed about the type of research design that is used. And a physician must explain all facts of research, even if this means the patient may decide not to participate. Clinical trials are organized medical studies. Overall objective is to determine if the product is safe and effective. Many patients who participated in clinical trials have received a benefit, but not all clinical trials have a positive outcome. When research can resolve debate over the best treatment, medical research does not always give the answers. Sometimes treatment actually harms the subject. A conflict of interest may arise if researchers' interests are placed above the interest of the patient. Ethics of randomized test trials. Many believe it is unethical to use control groups because participants have no hope of benefiting from the study. Race-based control groups may produce ethical dilemmas. For example, it is unethical unless evidence suggests participants will benefit by the therapy. Problems with double-blind tests. Neither the experimenter nor the patient knows who is getting research treatment. Ethical questions arise with informed consent. Are patients fully aware that they may not be receiving any treatment whatsoever? they're only receiving a placebo. The Human Genome Project was begun in early 1990, or the early 1990s, and completed in 2003. The Human Genome Project is a research program funded by the federal government. Its purpose was to determine or map and sequence the total number of genes. A complete set of genes are known as one's human genome. By understanding the human genome, it provides a better understanding of the process of human evolution. It provides improved understanding of the relationship between certain genes and diseases. And the goal is the eventual elimination or control of genetic diseases. Genetic engineering, cloning, group of genetically identical cells that come from a single common cell. This permits study of genetic development and genetic diseases. There is opposition, mutation, emotional risk, or potential abuse of the technology. Gene therapy is where a gene is spliced onto the DNA of body cells to control the production of a particular substance. This type of therapy is still in its infancy. However, the opportunities seem to be limitless. Scientists are investigating many unanswered questions, but with every question, many ethical and moral problems arise. Genetic engineering, such as human stem cell research, which attempts to master cells in the body that can generate specialized cells. Stem cells can grow into any cell or tissue in the body. This would be a master cell. Controversy over the use of frozen embryos to conduct the research has led to Congress banning all federal financing for new stem cell research. Whistleblowing, this is the public reporting of dangerous situations. Employees need to exhaust all other means, have documented evidence, and believe that changes to prevent harm or injury will take place. Chapter 12 discusses ethical issues relating to life. Fetal development, when does life begin? At the moment of conception, the embryo stage, the 2nd to 11th week. Fetus is the 3rd month, or at birth. Assisted or artificial conception, AI, artificial insemination, which is the injection of seminal fluid into the vagina from the husband or donor. And AIH is an artificial insemination husband. Artificial insemination donor, an AID, is where a man donates semen for a woman who is not his wife. It is wise to require consent in writing from both the husband and wife. When an artificial insemination donor is used, the legal status of offspring may become an issue, and ethical considerations in artificial conception are always an issue for debate. In vitro fertilization, the ovum and sperm cells combined outside the woman's body, cells grown in a laboratory, are later transplanted or implanted into a woman's uterus. In most cases, unused embryos are destroyed. However, embryos may be frozen for possible future implantation. Surrogate motherhood. A surrogate mother agrees to bear the child for an infertile couple. The surrogate mother actually enters into a contract with the infertile couple. The couple must pay for medical expenses incurred by the surrogate mother. The baby M case is an example of surrogate motherhood. Some ethical considerations with surrogate motherhood. Is it right for the mother to give up the baby she has carried for 9 months? Does or should the child have an emotional or physical link to the surrogate mother? Will the relationship between the husband and the wife be altered if the husband's sperm is implanted into another woman? What is the sibling relationship toward a surrogate baby? Can a contract between a surrogate mother and couple be enforced? Sometimes there may be a court battle over the custody of the child. Potential embarrassment for surrogates. Some have likened her actions to those of a prostitute. Potential harm to surrogate's own child when he or she learned she gave one child away and received money in return. Other dilemmas include future emotional distress when the child learns he or she was taken from the natural mother. It reduces birth to legal arrangement and the exchange for money to cover medical expenses. Fertility drugs are drugs that enhance the ability to become pregnant. It increases a woman's chance of having multiple births. Physicians may recommend some of the embryos be harvested. This is referred to as selective reduction. Contraception. Contra means against. Conception is the union of male sperm and female ovum. The Catholic Church, its official position is against the use of contraception. Several states have laws that prohibit the selling of contraceptives to minors. Sterilization is medically altering reproductive organs to terminate the ability to produce offspring. Maybe surgical intervention such as a vasectomy in the male or tubal ligation in the female. Usually this is an elective procedure. However, it can be therapeutic, incidental, or involuntary. Voluntary sterilization, few legal problems for a competent person. It's becoming the most popular method of birth control in the United States. It's sought for a variety of reasons. Therapeutic sterilization may be done if the mother's health is in danger, or to unmarried minors. Consent for sterilization requires the patient's written consent. Many hospitals and physicians also require consent of the spouse. No current federal law requires consent from one spouse for another spouse's sterilization. Consenting individuals must be at least 21 years of age. It may be necessary if the mother's life or mental health is threatened. Eugenic sterilization is involuntary sterilization, considered to be unethical by many people. It's done to assure that parents won't pass defective genes along to their children. It must be proven to be in the best interest of the cognitively disabled person. Several states still allow sterilization of sexual deviants and habitual criminals. However, this practice has lost favor. Negligence suits related to sterilization. Many claims involve women who have become pregnant after sterilization has been performed. In some cases, negligence occurs during the sterilization procedure. Ethical issues surrounding sterilization and birth control. Eugenic sterilization is abhorrent to many people. Some critics ask if it is morally acceptable for those receiving state and federal funds to dispense contraceptive devices. Should violent sex offenders be ordered to undergo sterilization? Should women who receive Medicaid and continue to have children by unknown fathers be required to be sterilized? Should mentally incompetent women be sterilized? Are children treated as property? Is human life being destroyed? Abortion is the termination of pregnancy before the fetus is viable. In other words, able to survive outside the uterus. Spontaneous abortion occurs naturally without any interference, such as a miscarriage. Induced abortion is caused by artificial means, such as medications or surgical procedures. Roe v. Wade is the case decided by the United States Supreme Court that declared that a criminal abortion law in Texas prohibiting all abortions not necessary to save the life of the mother to be in violation of a woman's right to privacy. Supreme Court stand on abortion. First trimester, decision to have the abortion between the woman and her physician. In the second trimester, the state may regulate medical conditions under which an abortion is performed. The third trimester, the state may prohibit all abortions except to save the life of the mother or protect maternal health. Recommendations from the court's decision: first trimester abortions should be performed in hospitals. Approval processes for abortions should include other physicians in addition to the woman's physician. The viability of the fetus needs to be carefully defined. A woman should wait for a designated period of time before having an abortion and should receive counseling. Certain medical procedures, such as partial birth abortion, should not be used. A father's consent should be obtained. The historical progression of cases affecting abortion: 1976, unconstitutional to require the husband or parental consent before abortion. In 1977, states may refuse to pay for non-therapeutic abortions. In 1980, federal funds may not be used to pay for Medicaid abortions. In 1981, physician must notify, if possible, parents or guardians before an abortion on a minor. In 1990, federally funded family planning clinics were prohibited from giving abortion advice. And in 1992, trimester approach of Roe v. Wade was rejected, looked at as unduly burdensome on the mother. Partial birth abortions. Many state legislatures oppose abortion procedures that allow the fetus to enter the birth canal while still alive. A great deal of controversy has arisen about late-term abortions. Incompetent persons in abortions. This is a difficult ethical issue that arises when an incompetent person is subjected to unplanned or unwanted pregnancies. In some cases, court-appointed guardians, which are known as a guardian ad litem, speaks on behalf of the incapacitated person. The morning after pill, or the Plan B contraceptive pill, is a high dose of a contraceptive that can prevent a pregnancy if taken within 72 hours following intercourse, particularly in the case of rape. Opposition to abortion. People have very strong and often differing viewpoints about abortion. The Unborn Victims of Violence Act of 1999 provides legal penalties for any harm done to unborn children at federal facilities, and it treats all unborn life as a person. Employees' right to refuse to participate in abortions. Hospital employees have the right to refuse to participate in performing abortions and cannot be dismissed for insubordination. An employee can abstain as a matter of conscience or religious conviction. Funding for abortions is also an area of great controversy. Under the Hyde Amendment, the U.S. Congress limited types of medically necessary abortions for which Medicaid money may be spent. Ethical issues surrounding abortion. The Catholic Church and others believe it is immoral to deliberately take a life or quote-unquote kill an unborn child. Many people do not want tax money spent on funding abortions for women on Medicaid. Is it a violation of an incompetent person's rights to have to submit to an abortion? Is it appropriate to deny spousal consent? Should abortion be used for gender selection of children? Abortion is always a moral decision because it results in the loss of human life. Baby doe regulations. Child Abuse and Prevention Treatment Act protects disabled infants, prohibits the withholding of medical treatment, Baby K, emergency medical treatment, and Active Labor Act, the EMTALA. Conscience clause, the refusal to provide medication or care when religious beliefs challenge. The patients filed lawsuits and complaints. Workers cited religious discrimination. So far, there is no clear answer to this conscience clause. Genetic counseling and testing. Genetic counselors meet with a couple before pregnancy occurs to discuss the potential for passing on defective genes, the legitimate means to detect couples who are at risk for passing on genetic disease to offspring. Prenatal testing. Amniocentesis is the use of a needle to withdraw from the uterus a small amount of amniotic fluid that surrounds the fetus. The fluid is tested for the presence of genetic defects. A consent form must be signed before the procedure. Risks associated with the procedure include early labor. Conceiving donor siblings. Women conceive a donor sibling. Organs and tissues can be used to save the other sibling's life. Fetus is aborted if it's not a match. The Uniform Anatomical Gift Act safeguards against aborting fetus with the intent to donate organs to a relative. Genetic testing for newborns. Routine screening on newborns has become standard in many hospitals. All states have laws requiring testing for PKU. Ethical questions regarding genetic testing. Do parents have the right to be informed of all results of genetic testing? Does a person have the right to have children who are likely to be impaired? Is society ever justified in requiring people to submit to genetic screening and counseling? Does a small number of people with the potential for disease or genetic condition justify the expense of testing? Should public funds pay for genetic testing when parents cannot pay? Wrongful life suits are lawsuits that are often brought against physicians or alive when a baby is born with severe defects. Some lawsuits are brought when sterilization fails. Wrongful conception or wrongful pregnancy. In 1991, in a case, parents were awarded the cost of raising a child to adulthood after the child was conceived following unsuccessful tubal ligation. Geriatric mothers and inherent risk are often cited as grounds for having that particular type of lawsuit. Safe haven laws. Infants can be safely left in safe haven places if unable to care for them, such as hospitals, police stations, or fire stations.